I will be faithful to the Republic of South Africa and will obey, respect,
Now,
and uphold.
one of your main tasks is going to be to implement the NHI.
Absolutely.
Many people, and you've heard that criticism many times, say you should first fix the public health system before you implement the NHI.
That's a joke. Any human being who stand up and say, please fix the healthcare system before NHI, he's either is a joke or is extremely ignorant or is so greedy that he wants to put something as an obstacle that he knows won't easily be removed.
And you've kicked off with a roadshow. I believe it started off in KwaZulu-Natal with a meeting with doctors, but there's also already been criticism against this roadshow. Business has criticized and the DA has criticized, saying the roadshow is not consultation, that's just a roadshow. So what's your aim? Are you gonna just get buy-in or are you gonna get real input?
I never got told anybody that I'm going to do consultation. I don't know where that come from. Consultation for what? I said I'm doing road shows. For instance, when I went to KZN, I'd already been to Sefako Mahatu that morning, and in the evening I went to KZN. It was not part of my road shows. They called me, they invited me and said, we want to hear more about this NHI. We are confused because the media is confusing us. I received a lot of WhatsApp messages, sending me an article which was penned by somebody from Momentum Life, who was claiming that NHI is going to cost 1.5 trillion rand. But that article was absolute rubbish. I can classify that as sort of mathematical hooliganism. I think we need to stop that type of hooliganism. It's unacceptable. We can't build a nation through that, through scaring people off because we happen to be having information.
I hear you that we need the correct information on what universal access to healthcare is and also what the NHI will do. But within your government of national unity, the second largest party is the DA, and they love private medical aids. Their health policy is based on expanding access to medical aids when the NHI plans to do it in a different way, by changing medical aids in their current form so that they don't provide the NHI services but only top-up services. How are you going to get the buy-in of the DA?
We went into the government of national unity knowing very well who we are going with. We knew. And nobody said people who go into government of national unity are alliance partners. They are not. We are not an alliance with DA. We just went into a government of national unity with them because the situation demanded it. We know the policies are market-related, business-related, and our policies, for instance, is on the mixed economy. We knew there will be such contradictions. We'll sit down with them and resolve them. If anybody believes because of this misunderstanding, then the government of national unity should collapse, that will be very unfortunate, but what can we do? That will have been their choice. For that matter, that will have been something that they've chosen. But me, at the moment, then I've listened to them very carefully. I've even listened to Freedom Front. I'm not going to sit with anybody who totally doesn't want any reform on healthcare system financing. That will be a complete waste of time because they've made up their mind. So I'm going to people who are willing, who want to understand, but who are willing to make proposals about improvement.
So proposals about improvement, does that mean improving the NHI Act or does it mean improving the health system in general?
No, I don't want to preempt that. It's not me who said I don't want anything in this form. It's the people. I want to listen to them. When you say you don't want universal, you support universal health coverage, but in this form, in which form do you want it? I want to listen. Maybe I can learn something that I never knew about.
So if there's something that a party who supports universal access to healthcare but has suggestions, for instance, Section 33 about medical aids, would you be prepared to compromise in some way, or is it staying like that?
Compromise where?
Let it go.
Where? What must go? NHI?
If they say the NHI can be there, but they want medical aids, they want the right to a medical aid and to get NHI-like services from a medical aid, would you say that can change, or would it stay the same?
What will that mean? You can't come to me and tell me that, no, I support this universal health coverage, but it must go. Because that's exactly what you'll be saying. If there's a house which has been built, and you say, I support this house, but I want the foundation to go. The roof and the walls will remain. Don't you know that it's going to collapse?
Do you think there's a chance that the GNU, that there would be a repeal of the Act or a request for that? Or how do you think things will play out?
Let's leave GNU out, Mia. I've been in government for ages now. I've never seen an act on earth that is never amended. Even the Constitution itself has gone through amendments. There is no law on earth that is cast in stone that never changes. I want to put that clear. And your colleagues, they will go and write and say, Minister is saying NHI is going to change. Simply because I'm making a statement, because I'm being honest. Just put a law here on the table which no human being can change. All the laws have changed. And you change them if you think it's necessary. If we go there and say, no, we're going to that dialogue, this one, never, that one, never, then we may as well not have a national dialogue. If, for instance, during CODESA, somebody said, yes, we support freedom, but apartheid must stay, what do you tell him? Who said, okay, we support freedom, it's a good thing, but apartheid must not go away, we still want it. What message are you saying? What are you telling me?
You've mentioned the legal challenges at the beginning of our interview that you had to study through, and there, I think, about 6 of them that might go to court. How do you think that's going to play out? Is it a stressful factor for you?
There are 2 court cases already. The dates have not yet been decided upon. I've got cause to believe there are more, definitely. There's no way there are only going to be 2. There will be more. And we are busy preparing for that. We are busy sitting together, preparing for that, gathering as much information as we can get. We will put in front of a judge. If we are wrong, we will accept it. We part of a constitutional democracy. If other people are wrong, they also must accept it. But it's quite unfortunate that we have to even to rush to court. But I have learned, I come from Home Affairs. Everything that people don't like, just by not liking it, they've given it a new name, unconstitutional.
Now, relating to that is something you've received a lot of accolades for, is when you were Health Minister the first time around, you really expanded our HIV treatment program. It became the largest one in the world. And if we look at the NHI, today we still have about 400 new infections each day, but the NHI says undocumented migrants can't get ARVs. Is that wise? What's the logic behind that?
It's a little bit more complex, that issue about undocumented, because undocumented people are generally not known. What I heard, which was a matter of concern, is asylum seekers, because that's not what the Immigration Act say. So if there's a mistake in the NHI Act about that, it needs to be corrected. But the whole issue of people being undocumented is very complex. We are going to have to sit as a continent to deal with this matter. I can tell you it's not going to be solved by one country, least of all by one minister. If you don't have resources, what will you do? Like COVID, as it was HIV, AIDS, drug-resistant TB, malaria. If you refuse the treatment, it's going to spread around, then you are working in reverse.
Let's just get back to the ARVs. So you've mentioned that if it's an infectious disease, it's necessary that we stop the spread. And if someone takes the ARVs, then it's also prevention. But the NHI Act does say that notifiable diseases will be the ones that we would give treatment regardless. And HIV is not a notifiable disease. So with the ARVs, we won't be giving that.
I know that HIV is not notifiable, but it falls within the definition of notifiable disease. It's not notifiable because South Africans refused. We stigmatize HIV/AIDS over a long period of time. People are refusing that notifiability. And in fact, if it was officially notifiable, we'll have gone a long way, because we'll have known who is where, if you understand what I mean. Because notifiability for a disease is to make the health system know who is where and who is infected. So the fact that legally South African refused us to put as notifiable does not mean that we must not treat it like a notifiable disease. And I'm sure when they said notifiability, they were not thinking they are excluding HIV, because we are treating everybody with HIV positive.
But for NHI and ARVs, we will aim to treat everyone. Is that what you're saying?
Because otherwise, I don't think we'll be able to defeat the disease.